this is just identifying, trying to develop a very a model and a platform to rapidly replace one toxic payload with another using biotin, streptavidin approaches. So you just switch one with another one by modifying the toxin. And so you can generate a toxin, couple it to streptavidin, and then have it bind to your receptor. And so you can test many different toxins that way. And then each toxin can be compared to one another. They bind to for instance, bind to the same antibody. So you can test 5, 6 different toxins bound to the same antibody on its ability to condition for transplant. And in a mouse model, you can't do this easily in a human because you need to develop human reagents. But in a mouse model, you can test whether these different ADCs have a short-term effect, a long-term effect, whether it has off-target toxicities. Obviously, the antibodies would be mouse antibodies directed against mouse antigens. And so you can look at side effects and toxicities, but more importantly, you can look at the ability to ablate the host bone marrow and get donor bone marrow to engraft. And so there's 2 kinds of engrafted donor bone marrow. There's either syngeneic or allogeneic. And so, the toxins can be directed to targets that are expressed on the immune system of the host and the stem cell population of the host, like CD45, or they can be just on the immune population of the host, like CD7, CD2, something like that, or they can just be on the stem cell population, like c-KIT or FLIT. And so you can test these different toxins bound to specific antibodies, and then test if those antibody drug conjugates, based on these easily exchangeable streptavidin biotin platform, can allow for syngeneic transplants. And in a mouse, it's just using these allelic differences between either BALP or BALP-BLAC6 that have a little polymorphism difference between one strain and another, which is which is a syngeneic transplant, but they just vary in this one polymorphism. But you can track it. And so you can do a syngeneic transplant, like an identical twin transplant, but track the cells and see if they engraft. Or you can do minor mismatch transplants, half mismatch transplants, or completely fully mismatched transplants in the mouse, and see if that drug conjugate will overcome immunologic barriers and also condition the recipient for transplanted stem cells. So you can also imagine this could be tailored for CAR T-cell therapy as well, right? Because you have to condition the recipient for CAR T-cell therapy. So one of the things you can think about doing is conditioning or depleting the cells in the host that are specifically relating to rejection of the CAR T. So you can imagine many different targets which are potential on NK cells or on T cells of the host that might be good targets for either an ADC or a CAR T cell targeting those populations that would allow engraftment.